on the record button now. The purpose of the session today is to look at how different organisations across the district are supporting vulnerable people. And I'm really pleased that our first speaker is Sonjia from the Hale project. Sonjia, are you able to unmute and introduce yourself?
Yes, thank you, Shadim. Good afternoon, everyone. And just to say a really big thank you for being invited to come and speak today. It's really great to have the opportunity to see lots of new faces. I can see a few familiar names and faces as well. So forgive me because you will know some of this. But a whistle-stop tour of Hale and how we work with some of the most vulnerable people in the district. And I'm going to time myself so I know I don't go over the 5 minutes. So we're a registered charity. We're a health development organisation. We've been around for about 20 years. In the early days, we were very focused on working in the Shipley and surrounding areas, but as with many charities, we've grown and developed over the years, and we do offer services right across the district now. So on average, we probably work with around 16,000 people a year, which is incredible for me even to think about. We have a team of 37 staff and we have about 100 volunteers. And our work is broken down into a range of areas really. But ultimately, our mission is about improving health where there is greatest need. So of course that cross-cuts through many different areas of work, and some of you will know about the work that we do. Our biggest service is social prescribing, and really I think our work is encompassed around connecting people and joining up the dots for people. Often when we meet people, they present with a specific issue, but actually I think our work is about spending time understanding more about individual need and what is the root cause of that issue, and then working alongside an individual to make sure that we can help them address some of those issues that are long-standing, that have been entrenched, that are actually the root cause of them presenting with ill health or non-clinical issues that individuals often present at their GP practice with. And once you get into the detail, you really do start to paint a picture of the lives that people are living, and that actually no clinical intervention will address their debt or food poverty or poor housing. You know, and I think it's about looking at how we ensure those people are given the information, the encouragement and the tools to be able to start accessing some of that wider support that will allow them the opportunity to kind of improve their overall situation. I think our technique's really about that change talk method, where we look at a strength position for every individual. Where can we start from? What are the good things that you've got going on in your life, and how do we build on that? Some of our other services, we have a befriending service, which is part of a wider district network of befriending. Ours focuses on the Shipley, Bingley, Baildon area, but we are working with lots of other providers across the district. So we're trying to support and mentor other fledgling befriending services so that more people can benefit from that. And again, that is absolutely about addressing loneliness and isolation for our most vulnerable people. I know throughout COVID, we've certainly connected with more people than ever before. And they have said actually for them, COVID in some ways has been a positive thing because it's enabled them to finally have some connection with their wider community they were otherwise unseen. We obviously as well play a really big role in voice and influence. So we have a community engagement team and a community development team, and they're out on the ground getting involved in grassroots projects, having conversations with individuals about how they feel about their health and their wider world, what's happening for them in their everyday lives, what's important to them. I think we have a really diverse team, which does allow us to connect with a much wider representation of the community. And we collect all of that information and advice. And their kind of suggestions and ideas that they've got about how things can change for the better, and we feed that into the system. And I think we really have started to see how the system take that intelligence and start to frame some of the services and some of the system changes based on that grassroots information that we collect. I think we do have some smaller projects, but again, they're really quite impactful. So we're part of partnerships across the district with Warm Homes, Healthy People. We're involved in the Young People's Sexual Health Programme. We've piloting a new young people social prescribing service in city and started to expand on that. So we're really keen to develop new ways of working to test out what we think is going to be best fit for our community, designed with the community together. So that's a whistle-stop tour of Hale and how we work. There's loads more I could tell you, but my 5 minutes are up, so thank you.
Awesome. Thank you for that, Sonjia. And yeah, it's great to hear more about the work, and thanks to Khalil for connecting us as well. And it's good to see all the different partnership work that's going on across the district as well. Our next speaker is Humma Niazmi from the Race Equality Network. Humma's going to share with us some of the work that they're doing around COVID. Humma, are you okay to unmute yourself and jump in?
Yeah, good afternoon, everybody. My name is Humma Niazmi. I'm the project manager at Race Equality Network. Excuse me. So we have been delivering the COVID prevention project for BAME and Central Eastern European communities across the district since last year. It's an 18-month project, and it's to ensure that communities across the district have up-to-date information around test and trace, infection control and outbreak management in different languages on different platforms. And it's really working with grassroots organisations to make sure that information is reached to all communities. So we have secured some further funding to deliver the Community Champions project. So that is a project that will scale up the work that we are delivering across minority groups. Equality Together will be focusing on delivering the project with disability groups, and it's about expanding the remit of the council's ambassadors programme as well. So it's about recruiting up to 300 champions across the district from BAME and disability groups to make sure that information is up to date and current and delivered to communities around test and trace, COVID, and especially clear guidance around the vaccinations. So what the champions will do is they'll undertake some training, which we're putting together with the council, and it will focus on anti-rumour work, vaccinations, and how people can dispel some of the myths and misinformation that's been circulating on social media. So the Champions project will hopefully kickstart in March. We are just recruiting some project officers to deliver the project for Race Equality Network. And currently myself and Hattie have been delivering the project since last year. So it'd be really good to have some more staff on board. And it's a 6-month project. So we are looking for partners. We are currently, with this remit, going to expand on the work that our partners have been delivering through the COVID prevention project. So we are intending to work with 36 organisations, and we are looking for partners from BAME-led organisations who we're not currently working with. So if you think that we're not reaching into certain communities, please do get in touch with myself or Hattie, and we'll put the information in the chat box. So because it's a really short project, we envisage that the training will be undertaken, and champions will have the up-to-date information and guidance and the confidence to speak to their communities around vaccination hesitancy, around the vaccinations, and make sure communities have up-to-date information so they can make an informed choice whether they want to have the vaccination or not. It's not a forced rule at the moment for have vaccinations because there's so much misinformation out there. It's really important that we utilise the skills that we've got across the district. We've got fantastic champions that are doing great work, and we want to really build on the champions that have already got existing links with their communities and that trusting relationship. So if you would like, to get in touch with us and become a champion or find out more about our project, then please do get in touch with myself. We are also on Twitter. We've launched a YouTube channel where we post up-to-date messages in different languages around self-isolation, the Christmas bubble, the national lockdown, and we are working with BCS partners to make sure that we have a wide reach across the district, and that includes Keighley as well. So if you would like to get involved and like to know more about the project, please do contact us. And I was having a conversation with Shadim earlier about really utilising those champions, from the business sector as well, from the voluntary sector, people that are working in health, people that are working with the council, those people that have got a really good relationship with their own community, they can become a champion. So if you feel that you'd like to get involved, then please do not hesitate to get in touch with me. I think that's enough, Shadim, from me.
Absolutely. Thank you so much, Humma, and well done for all the great work that Run have done in such a short space of time. It's good to see. Next speaker is Mr. Siddique. Kami, over to you.
Hi everyone, thanks Shadim for the invite. I can see that you've written Kamran Siddique from Jump and BD5. I must be, representing BD5. I just want to say, just as a lifelong Bradfordian, that thank you to everyone that's kind of been out there, and this gargantuan effort of, once again, the community and voluntary sector filling the gaps when they've been needed. And throughout this pandemic, it's very obvious that the sector is massively important to society, and yeah, it should be commended at every opportunity. So my name's Kamran Siddique. I'm the Community Engagement Manager for Jump. Jump stands for Join Us, Move, Play. You might think, how does this link in with vulnerable families? But I'll share a little presentation with you to see where it does fit in. Just give me a moment. If I can have some thumbs up for from people to say that they can see this. Just 1 second. Everyone see that? Yeah, lovely, thank you. So Jump is part of the local delivery pilot from Sport England. Sport England a couple of years ago gave out funding to 12 organisations across the UK to make a step change in physical activity for local people. We're one of them in Bradford. We're very lucky in this current climate to have resource and to have money. We know obviously austerity is hit massively in these areas, and we're really lucky to have that that finance behind us to be able to do stuff a little bit differently. We have a whole systems approach, which sounds like a little bit of jargon, but what it actually means is that we're connecting every part of the jigsaw together, which includes schools, local community centres, the voluntary community sector, the statutory sector, the council, and even knocking on the door of policy and making change at that higher level. Some of the ways that we are doing that is working within a specific area in Bradford. It's what we call the north of Bradford, which obviously local people will know that doesn't exist. It's an area based on our cohort research. So we are working with Born in Bradford as our research programme, and the cohort study has identified the key areas of development within Bradford based on the young people and the families that are involved in the research. You can see that it's quite an odd area. When I first started, I was thinking, why these patches? But they all have very specific demographics. So from Allerton all the way across to Thorpedge, there's different types of people that live there. And again, it's based on the cohort as well. I lead on Allerton, Windhill, and the Heaton area. there's 2 more of me, believe it or not, for my sins, and they lead the other areas within Bradford. The stats are quite stark. Physical inactivity contributes to 1 in 10 early deaths. It's equal to smoking. 77% of children are not reaching that per day in Bradford. Again, really stark. And Black and ethnic minority children are less active than white British children. These are stats from our own research back in 2014. And as you can see, you know, there is a massive need to be doing stuff around physical activity. This is the whole system, quite complicated. Also can be quite simply explained to from individual level all the way through to policy. Because we can't eat the elephant all in one go, we're trying in smaller chunks. So we're working through pioneer neighbourhoods. Basically, an active green space is surrounded by mosques or schools, local community organisations, and we use that to activate communities to actually do physical activity. A lot of it is around sustainability, so it's not just putting on activities, but ensuring that we have leadership, we have children and young people doing for themselves, and we have the idea that we are teaching a family to fish, which means that they will, you know, continue to do this once the project's gone. The big thing for me as a local person is that, and I've seen it a million times, where funding comes into the area and then when it disappears, it leaves a vacuum within communities. And that's the last thing we want to be doing. We want to be developing local people with skill levels and ensuring that sustainability and things continue to happen once the project finishes. We are a social movement, so we stand for Join Us, Move, Play. So it's not just a project, it's about an idea. It's about keeping stuff that remains. And once it goes, people will continue to move and play. That's enough of the sharing. I'll just stop sharing there. Do that. Sure I can do that. Stop sharing. There we go. How long have we got, Shadim?
1 minute summary.
Okay, just yeah, a minute summary. So in terms of vulnerable families, I think right now that term has changed for a lot of us. Vulnerable is pretty much everyone vulnerable to illness, vulnerable to losing jobs, and I think one of the positive things that have come out of this pandemic is that the government have identified that physical activity is massively important. And you know, we know in the lockdowns they've specifically said that exercise can happen and needs to happen, and that's a positive thing for us. But we've been doing play packs. We've sent out 60,000 homes individual play packs with resources. We've worked. It's not means tested. We work with local community organisations for them to identify families. You know, we're not doing this judgment thing. It's open to everyone. We're working through the schools. We've 13 schools at the moment. We will be working with another 27 over the next couple of years. That's primary schools, and then secondary schools. Again, we have around 15 secondary schools that we'll be working with. I can see around the screen that there's certain people that we've already worked with and are working on the Jump project, which is good to see. And yeah, that's what we're doing with vulnerable families. If you'd like to get involved, if you can see there's some sort of connection somewhere, then I'm sure we can share our contact details through this forum or on email.
Absolutely, Cami. If you drop your details in the chat, Gulsum will pick that up and we'll share it on the minutes. And I'm sure if anyone wants to get in touch, then they can do. But thanks so much for the great work you're doing, Cami. And thanks for supporting our families as well with the activity packs throughout the pandemic. Our next speaker is Dr. Clare Relton from Queen's Mary University of London. Clare, are you okay to unmute yourself?
Yes, hi, can you hear me?
Yeah, great. You're our first speaker from outside of Bradford, so
Okay.
welcome.
Great, Well, thank you very much for inviting me, Shadim. I'm delighted, and it's really fascinating to hear what's going on with the various groups. So I'm looking forward to hearing more. Can I just share my screen? Let's. There we are.
There's a green button in the middle of the. You got it, yeah?
Is that working?
Yeah, it is, yeah.
Okay, so yeah, my name's Clare Relton. I was at University of Sheffield for 15 years, but then I've migrated down the south to Queen Mary University, London. And I work, oops, hang on, is it gonna, in the Institute of Population Health Sciences. So we're interested in the health of populations, and our team are particularly interested in how can we make sure that everybody in the UK has access to food that's healthy, good quality diets. So we know that there's a government scheme called Healthy Start, which has been going on for a couple of decades. We know that uptake of the Healthy Start scheme is declining rapidly. I think it's less than half of eligible families are now claiming Healthy Start vouchers, and it actually only targets those who are already on some sort of income support, who can actually get their way through the Healthy Start online application system. So. And we know there's still huge problems in the UK with diet for all populations. We can just look at the UK as a nation and know that actually what we're eating is not right when we look at our obesity and overweight rates, with 60% of us being overweight or obese. So we know we're not feeding our nation correctly. And this is particularly in areas, even worse in areas of high deprivation. We know that the system we have for feeding ourselves as a nation is really complex. So about 3 years ago, I was working at the University of Sheffield, and we came up with this idea of something called Fresh Street. So, and we piloted this new idea, which is, rather than targeting families which are claiming benefit, actually trying to produce an intervention which is, or a scheme which is affordable, is for everybody. So we came up with this idea of Fresh Street, which is a bright green weekly envelope which contains 5 £1 vouchers which can be exchanged for fresh fruit and veg in areas of high deprivation. So, and they're for all households, and the vouchers are, so the vouchers can be used with local independent fruit and veg suppliers, not supermarkets. Although we love supermarkets dearly, we actually know that when we walk through a supermarket, we're very tempted to buy food that's not healthy for us, i.e. ultra processed food. So they're tantalizing that they're not good for our nation in terms of what we're eating. So the vouchers are for local independent fruit and veg suppliers, so market stalls, fruit and veg box suppliers, fruit and veg shops. And all households are eligible in the areas that we pick, not just those that are claiming benefits. So it's basically, it's trying to change the whole behaviour and support whole areas to change the way that what they eat and how they eat and where they buy it. So included within vouchers each week in this bright green envelope, we pop in an easy vegetable-based recipe, a bit of nutritional information, healthy eating messages. We can pop in other things as well. So we came up with this idea in 2017. We were very lucky and got some funding from the Medical Research Council, and then Barnsley Council said, yeah, we'd love to test this. We tested it in an area of high deprivation and low fruit and veg consumption in Bradford, and it went really, really well, far better than we thought. So 8 out of 10 households who were eligible for the scheme joined and stayed in the scheme for the whole year, and used almost all the vouchers at the local fruit and veg shop or the 5 market stalls in Barnsley Market. And all sorts of people talked about it. The main thing was people said, I feel prompted and supported. It reminds me to eat fresh fruit and veg, and it enables me to eat fresh fruit and veg. We encourage people to share the vouchers. So this is a non-stigmatized intervention where everybody can go, oh yeah, I've got my vouchers this week. Oh, what fruit and veg am I going to buy? I'll give some to my daughter-in-law. Let's go and get some fruit for the kids. And then the money actually goes back into the local economy and not off to the supermarkets and off to Walmart. It actually keeps the money in the local system and engages people with the local food system. So we were delighted with the impact. We published it in the Journal of Public Health. And then just very recently, we've got some funding from the NIHR, the National Institute of Health Research, which is the research arm of the Department of Health, to do a much bigger study and actually really start to assess the value and impact of this idea on families, children, households, fruit and veg retailers, and the whole food system and the local environment. So we're looking at exploring what's the impact of Fresh Street on local food systems, households, etc., in areas of high deprivation. So areas in the bottom 2 quintiles, so the bottom 40% of society in terms of access to resources. We're working with top researchers from Cambridge University and Sheffield, and we've got support from Doncaster Council, and we're running it first in Doncaster, but then very recently the Director of Public Health in Bradford and also in Tower Hamlets in London have also said that they'd really like to try to test this out. So we're going to be piloting it in Bradford and also in Tower Hamlets, possibly also in other areas as well. So there's a lot of councils that are really keen to take part in this. The key crunch is actually getting money for the vouchers. So it's amazing when the Directors of Public Health actually managed to find a little bit of their hard pressed resources for that. So we've set up a website, www.freshstreet.uk, which has got a bit more information in. So we're now at the moment working with Rose Dunlop, who's one of the public health consultants here in Bradford, and we're starting to work out whether we can actually get a significant amount of money for some vouchers so we can choose a big area. We know we've got a little bit of money so we can choose 1 or 2 streets, but we'd like to do it at scale and have areas which have the vouchers where all the households in the streets that we randomly select have the vouchers for 2 years. So we're not just talking about something going in and coming out. We're actually wanting to change the culture, changing the local food system and the behaviours and the resources that are there for people. So testing it for 2 years in these areas and then comparing what happens in areas where the scheme isn't offered, and hopefully trying to persuade the government that actually they need to support people to eat healthily with dignity and giving them choice and getting the money back into the local economies. I'll stop there. I don't know how much time I've got left.
No, that is fantastic. Thank you so much, Claire, and really excited about this project, and a shout out to Rose Dunlop for connecting us.
Yeah.
And some of you will know that myself and some of the others, Kathy Henwood as well, are on the Bradford Council Food sort of Poverty / Strategy Group that are looking at some of the longer term challenges around food distribution, and this is a really important project, and I guess there's never enough time, well, 5 minutes is definitely not enough time to really give this justice, but you can see from the chat, Claire, that lots of people have shown an interest in this.
Right.
If you could share your contact details in the chat, and then we'll have that follow-up that we discussed and sort of revert back to other organisations that might want to connect into the project as well. Okay. But thanks for joining us, Claire. Going to pass over to Kaneez now from Neighbours. Kaneez, are you okay to unmute yourself?
Hi, everybody. I think Karen wants to ask a question. Karen Dalbar.
We're just going to leave the questions till the presentation's over, if that's okay, Kaneez. Yeah.
It's a question.
I'll do it by email. It's okay, don't worry.
Thanks, Karen.
Thanks.
Yeah. Do go ahead, Kaneez.
Hi, everybody. I'm Kaneez Khan, and I'm the Neighbours coordinator for West Yorkshire. So I cover Leeds, Bradford, Dewsbury, Keighley, and Batley. I'm trying to remember all my areas because there's quite a bit of them, and we haven't been physically out in them lately. And all my work is run through Wellsprings together. So Kathy's here, and we work together. So we did a huge piece of consultation with government last year. Shadim was part of that. Quite a few partners in Bradford that were part of that, around why people weren't engaging with test and trace. They really particularly wanted to speak to Muslim communities, Sikh communities and Hindu communities from Bradford. That's the part that they came to me for. And they also did a lot of consultation across the country separate from us. But I think when it came to our turn, we just happened to have the meeting the day after the 2.5-hour lockdown announcement for Bradford and Kirklees. So the first working day after Eid on the Monday, we had a meeting with the ministers, and they actually heard it straight from the horse's mouth, how the communities felt in Bradford, and the Muslim community particularly, about their announcement and how much it had hit home and how much they felt like it was finger pointing towards Muslims, that we are the people that are spreading COVID as a result of this whole consultation. So it wasn't just us, there was loads across the country, but I think ours was quite powerful. in its response from here. The government then gave loads of, have given about 25 million, I think, for Black, minority, ethnic and special needs engagement, as some of the councils have received and as we have received as an organisation. So we received 1 million across the 10 hubs, and we've got 10 hubs across the country. We're one of the hubs, and we're going to roll out a piece of work. So the three strands to our work. One strand is our small grants, which have been started about a couple of weeks ago, up to £4,000 worth to small community groups to do some grassroots work around COVID support, whether that's mental health, whether that's messaging, whether that's engagement, whether that's, it won't be food work because we've done, or there's been a whole host of food work that's been done previously. And then our second strand of work is we've got 5 surge partners. So this is called surge funding. We've got 5 partners, and I've got 2 in Bradford, 2 in Leeds and 1 in Kirklees at the moment. And we're going to work with them around more intense messaging, and they will be working with at least 8 people each from each group to be community champions around the messaging. And yesterday was one of the first meetings that we'd had, and it was a Leeds group called Black Health Initiative. They had over 100 people that turned up from the community. Really, really challenging conversations around how frightened people were of the vaccine, about what would be the long-term side effects generationally, never mind on this generation, could it affect our children, so on. Lots and lots of questions, but also to have the doctors to be able to answer those questions for them. So that's the type of work we're going to be doing with our 5 partners locally. And then our third strand of work that we're doing is we're having a roundtable next week that's going to be hopefully feeding straight back to Department of Communities in London, straight from West Yorkshire, the concerns people have, the brilliant work that's going on, positive stories of hope, but also the challenges around engagement. We're going to have a COVID cash course, which is about financial inclusion and trying to let people know about their rights. I definitely know in Leeds that this is happening. Some of the takeaway people are still going back out to work, whether they're supposed to be isolating or not, because they don't know they're allowed the £500, and they'll go into debt if they don't go back out to work because they've got so much family commitments, living in 2 or 3 generation households. It's really difficult for them. So that type of thing. So COVID cash course, a digital inclusion one, an advanced one, and a beginners one for people who want to get onto the Zoom. And so that would be like for women that might not have the language, or men that might not have the language and want to get onto Zoom, but then a bit more advanced for people that might want to like make a website for their organization. And then the 4th piece of work that we'll be doing is around young people. And this, so that will be a course for young people within West Yorkshire. This work has to be done quite quickly. We're working at pace. I think I start at 9 o'clock in the morning, finish at 7 o'clock in the night. I had COVID in December. I have 4 children at home, all in separate rooms, working at the same time. So yeah, it's a bit of a crazy time, but enjoying it. And I'm glad that we're doing it because hopefully it will be about saving lives. Yeah, we've got targets to meet, but it's not about targets for us. It's about actually getting that equality, getting that message out there, helping people to understand what COVID is, why it's happening, and why we're more at risk. Because even though I was on the front line from March last year, I got it, but my colleague who was on the front line a lot more than I was, she did a lot more contact work than I did. Actually, she didn't get it, and she was from the white British community, and I was just like, I got it, and I was how much less than you. How come I got it? But I think it's got something to do with our DNA, our makeup, whatever it is. We are much more prone to getting COVID and then dying from it within our families and communities. So that's it, I think, from me. That's what we're doing right now.
Kaneez, fantastic work. I can hear myself echoing. Is it just me or oh, that's gone? Yeah. We could probably have a full session for the work that Neighbours does and your connected organisations, Kaneez. But thanks for all that you do, and we will allow some time, hopefully at the end after the other speakers, for any questions for Kaneez or Clare or anyone else. I'm going to pass over to Marcus now, Professor Marcus Rattray from the University of Bradford. you know, and this is just gives you an indication of how well connected Bradford has become. You know, I've been having a few conversations with Professor John Wright, who'd spoken at one of our earlier events, and John had connected with Kim Shuttler, and then Kim Shuttler had sent it back to me and reconnected John, and John had connected me back to Marcus and said, well, actually this paper that Marcus had written to support asylum seekers and refugees, we should look at how organizations in the city that are actually on the front line and supporting those vulnerable people, how they can take advantage of this paper and how it can be put to use. So, John, are you okay to unmute yourself? Marcus. Marcus, are you okay to unmute yourself and speak now?
Yeah, yes, certainly. And thanks for inviting me. It's a privilege to be amongst everybody here. So I'm just going to describe briefly some work that was led by Melanie Cooper at the University of Bradford that I've contributed to. And Mel can't be here today. That's the only reason you got me. And Mel's worked for many years with mostly around maternity health and with refugees and asylum seekers, and she's part of the City of Sanctuary network as well. And we got some funding from NHS England that was topped up by the University of Bradford to look at the impact of the first lockdown on refugees and asylum seekers on a whole range of things. That survey was done in July. So actually, some of the things are important still, but what we wanted to highlight was some of the aspects of the evidence that might be useful for people such as yourselves who are working day on day with families and groups in this case in Bradford, but the same things are true for everywhere. So it was really to try to understand, to try to get evidence about how people felt and the impact of the pandemic was, and focusing on things where evidence might be used to change, in some cases, change the way that things are done. So I'll just whiz through a few things. We asked a lot of questions. One thing was about food, and just to quote some statistics, before lockdown, we spoke to 100 refugees and asylum seekers. About half of those people were in or around Bradford. It's a little bit complicated because, of course, sometimes people get placed in Bradford and then moved somewhere else. Some people were living in hostels under very difficult conditions in shared accommodation. Other people were more settled. We didn't try to distinguish that. We wanted people who were self-identified as refugees and asylum seekers. So actually the 100 people represent a whole wide group of individuals with individual needs, and there are some commonalities. So before lockdown, about 40% of the people we spoke to had been regularly in receipt of food parcels. And of course, it's no surprise that after lockdown, it was 60%. So in other words, that proportion of people became dependent on those things became higher. When we asked about what people felt about that, about 10% of people said they didn't get enough food, and this was a particular problem we knew in some of the hostels and accommodation, which hopefully has been sorted out. But I think most interesting and relating to things that have already been said, there were some comments about the sort of type of food, and they mostly boiled down into the negative comments where the people didn't have as much choice as they would like, and a lot of comments about not having fresh fruit and fresh vegetables. So the sort of contents of the food parcels were not necessarily appropriate. So I'm pretty sure that people here are already on that kind of thing, but I think it reinforces probably what's already being done. It's a good idea to give vouchers, to give choice, to include fresh fruit and vegetables amongst the other very kind donations that people are doing. We also asked about, and we did actually get a bit of information about where the best food parcels are from, a sort of top of the pops kind of thing, and I'm not sure how relevant that is, but actually schools came out really high. So schools were pretty good. And it's not about negative about anybody else, but we're pretty good at sort of working out what they want, what was right for families with children, I guess. About 15% of the people we spoke to weren't registered with a GP. And that's really important because I'll come on to that a little bit with health messages. People do trust the health service, and that's really critical. So I think, one recommendation would be, it's not in the report that I'll share, but is if there was any way of helping people to navigate that difficult step to get registered with a GP, that as much as anything else will be really, really helpful, because that's a conduit to health messages and advice and trusted messages and so on. One of the things I wanted to focus on was the if I can find my paper, was the what do people think of the information they were receiving? You know, if we think about the information we all got during lockdown, I don't know what anybody else thought. I'm a very highly qualified person, but I found it really confusing and contradictory, and I'm not sure if I trust everybody's giving the messaging. So no surprises, all of that sort of stuff came through from a survey of people who identified as refugees and asylum seekers. But we did want to focus be a bit more specific about that and find out what the sort of barriers might be and how those, you know, to make some suggestions how about that might be overcome. So apart from the sort of content of the message, actually quite a few people were positive about the message. I think it's quite important to say. We did ask quite specifically about where people got their information from and where they would like to get their information from. So, so I'm just struggling with my own screen here. It's my own silly fault. Just to give you some information which you probably already know. So if we asked, you know, what's your preference about receiving information? Newspapers and radio, useless. 2% of people liked the newspaper and 2% of people liked the radio. So that doesn't work. I think you could say that very sure. Television was quite popular. About a quarter of the people really liked television as a way to receive the message, but less than half of the people we spoke to had access to a television, actually. So television is a preferred thing, but people don't have the television. They're often shut in a room for, in some cases, for months, and not able to actually see that television. Things like post, quite a few people would like to get more things by post. Text messages, actually, more popular than you might think, and that is a very effective way of communicating with people. And some people actually preferred receiving messages from other people, but even though that's not the most preferred method, only 4% of people said that's the way they preferred. Actually, almost everybody did get messages from other people, and that's a sort of cause of positive information, if you like. But also, as we know, social media and personal contact can be a source of what we might consider to be misinformation that might be, might put people at risk. Vaccination being an example. Quite a lot of people, without prompting, said they would really like to receive more message from trusted people, and they mostly highlighted health providers, GP and NHS, but they also, in some cases, highlighted the organisations that were working with them to support them, for example, with accommodation, with asylum claims, so charities, basically. So there's quite a diversity in the way that people receive their advice. It doesn't actually meet people's preferences. Because actually the way that people receive people's advice, about 40% got information from other people, about a quarter from social media, but the most common ways were through the internet and by social media. So those are quite good ways of getting messages out, but we know that, again, the quality of those messages might not be very high. And then we looked into sort of barriers to receiving, if you like, trusted information. That might be information about people being able to keep themselves healthy. And we found, I'm sure everybody knows this, that actually the digital exclusion is a massive feature, but it's not the device. So whilst not very many people had computers or tablets, 90% of people did have a smartphone or access to a smartphone, but only a third had access to Wi-Fi. So actually they had the smartphone but didn't have the money or data to use it. Less than 10% of the people we spoke to actually had a phone contract, and only 40% told us they had enough mobile data to access what they needed. So in terms of recommendations, I mean, I feel embarrassed to give you guys any recommendations at all, but where, from the evidence side of things, where it would seem most useful, get Wi-Fi or data to people so they can receive those messages, get people registered with a GP. Those would be the two things that perhaps can be done looking forward to the next challenge, which is vaccination. And just to mention that Mel's also just got some funding, or about to get some funding from NHS England, to develop a film that will support vaccination messages amongst that group of people. That will be designed by the refugees and asylum seekers themselves. Oh, actually, that's the other thing, is that the people that we spoke with would be really good at actually helping to define and refine any messages. Sorry, I've probably gone on too long, but that's my bit.
No, it's a much needed presentation, Marcus, and thanks for sharing. And you know, we've got Will from City of Sanctuary on the group here, and we've got Sue Crow's also joined from Bradford Talking Media, and between a number of organisations across the city, we've been involved quite early on with digital poverty. In fact, going back to April at the start of the pandemic, but it does really help to get this research and data. And we'll certainly share what you share there. Now, we do have one other set of speakers, a little bit of a late addition to the schedule. However, I think this is a wonderful example of how different organizations across the district can come together to deliver a real project in the community. So I'm going to pass you over to Matthew Langley from Bowling Park Primary School. Matthew, are you okay to unmute yourself? And I think Ian Shaw from Leeds University is also with Matthew. I know Khalil is on the chat somewhere as well, so Khalil might want to butt in at some point. It's likely that we might run slightly over if there is any questions, but feel free to drop your questions in the chat. If we can't pick it up before the end of the session, then we'll certainly try to do that after. But I'll pass you over to Matthew now, and I will be sharing some slides showing Matthew's presentation as well.
That's great, thank you. Good afternoon, everyone. Thank you very much for inviting us to speak today, but especially just to listen to some of the fantastic practice that's being developed across the city. And it is really empowering to hear the strength and effectiveness of those networks and the impact that they're having. I'm going to start just very quickly to give you an introduction, and then I'll ask Ian to take over and describe the project which we're developing in its very early stages. So I consider myself very fortunate to be the head teacher at Bowling Park Primary School. We have 2 school sites, one in BD5 and one in BD4. We're a very large primary school, 700 children, and we have a very broad range of families from but we also have a very significant number of very vulnerable families from a range of backgrounds. Despite that context, we're a really happy, ambitious, optimistic organisation, and we're very proud to serve the communities that we do. This project started really in those first uneasy days of the first lockdown, when as schools we were given very, very short notice on the fact that we were going to close, and we had to very quickly come to terms with the implications of that. So effectively schools were locked down on the Friday and we reopened on the Monday, but we reopened in a very different way, as well as all the challenges associated with learning and keeping our school community together. It was also very apparent that one of the biggest early impacts was going to be on our children's and families' access to good quality food. So we turned on our heels very quickly and set up a very large community food bank that served 200 families a day. And rather than, and this was before there were school vouchers or school lunch packs or any of those things, so we really were operating in a vacuum. So in partnership with a number of people, some local food banks, some local supermarkets. Sorry
to interrupt, Matthew. Can I just check if the screen's visible?
It's up. Yeah, that's perfect.
Okay, sorry, Matthew, please go ahead.
So we were able to open ourselves up as a really quite large scale food distribution centre. And instead of having people come to collect food, then we delivered food on a daily basis and a weekly basis to 200 families across BD5 and BD4. And we were very conscious of a number of things. It was really interesting to hear Marcus talk about the food choices that people were given. And we were very keen to ensure that people had access to the highest quality food that we could provide, including fresh fruit and vegetables. So we ran that for about 2 or 3 months, and it really shifted our relationship with the community, and it really shifted my understanding of what the school's role in the community was. And I think we've emerged from that stronger. Last week, we had a community food challenge, cookery challenge, and to do that, we distributed 500 parcels of fruit and vegetables, and then challenged our 500 families to create their own meals and recipes. And they've responded with that, and it's been an important development, another step. What we're very keen to do now with Ian is look at how we take that sort of food-based engagement a step further and look at what the long-term community impacts of that might be. So rather than simply just operating a food bank and a food support service to our families, that we're also looking at a way that we can open up our school environment, our school grounds, to enable families to be actively involved in growing their own food on site. And when you hear how that might combine with something like the Fresh Street initiative, it's the start of a potentially really exciting piece of work. So thank you, Ian.
Yeah, thanks. I think really the only thing I want to add to what Matthew has said there is the transformative effect that school gardens can have on young people and outdoor learning in particular. But the benefits of school gardens extend beyond outdoor curriculum to really change behaviours and attitudes that young people have towards their food, their environment. And one of the things that I really want to emphasise as an opportunity for developing a school garden system here at Baldwin Park is the development of lifelong skills. And so earlier it was mentioned that very often funding schemes can come in, swoop in, but then they very quickly lose their momentum. But the benefit of a school garden food system is that young people don't just keep those skills on site, they take them back to their communities. And so I'm really excited to really position and support Baldwin Park as a new kind of hub for producing food and for transforming ecological behaviours and attitudes. And I think the other thing to emphasize in terms of benefits, and one of the exciting opportunities of this, is the positive effect on young people's mental health. Yeah. And so in particular, it's no surprise that during this lockdown, young people's mental health has suffered far more than other generations. And this also connects to young people's anxiety about climate change as well. And so really, once again, a school garden can contribute and empower young people to make a positive difference to their own mental health, and also to empower them to think differently about the contributions they can make to their planet. So I'm really excited to work with Matthew and the rest of the school partners, and I can already see lots of opportunities for connecting to different organisations that have worked across Bradford. So thank you for having me. That's great. If I can just very briefly sort of summarise that. I think that sometimes our community, our school community, our community more generally in BD5, BD4, it's often presented as a deficit model, as people being sort of passive recipients of support and services. But actually that's not the case. We have hundreds of really proud, active families who deserve the very best that we can provide them with. I think Ian's point about children and young people having really paid a price through this lockdown. We're doing home visits now with children who haven't actually left their own houses for weeks now to engage in sort of any outdoor activity. There's a real situation, really serious situation that's growing here. So we are looking at how we can use this opportunity, use our grounds as part of a longer term COVID recovery, community recovery project, and how as a school we can play a very active part in that. Okay, thank you very much for taking the time to listen to us, and thanks again.
Fantastic. I don't think I did a great job with the slides there, Matthew. I was a little bit all over the place. But,
no, but so were the slides, so thank you for even doing it. I much appreciated. Like the Boris Johnson one, could you do the next slide, please?
But no, thank you for that. And it's really positive. I mean, I you know, as Cammie's mentioned as well, I keep emphasizing BD5 because I'm literally sat about 200 meters from the school as we speak. Yeah, so it is my neighborhood. It is my old school. So obviously it's only right that we had 2 BD5 speakers today, and I was trying to get Khalid in as well to make it 3 BD5.
Well, I'm over here, Shadim, so I'll say a few words if you want. So,
yeah, Khalid, it'd be good for you to just mention how Bradford for Better is connected to this project.
Of course. I'm just going to say that if you're 200 meters away, I'm probably 100 meters away, sitting in my living room. So we're very. We're very.
Can I just jump in? I'm about 50 meters away.
You actually are, yeah. You're probably closest. You're probably closer to the school. So yeah.
Can I just jump in? I'll put the kettle on for all of us.
No, it's a fantastic initiative, and I think there's lots of strands where I sort of connect to Baldwin Park personally. Obviously, it's my old school. I was there when it were a primary school up at Avenue Road, and you know, I have two of my family members that are teachers there, so it's a great kind of calling really for us to be involved in it, and especially through Bradford for Better. So I'm a core member of Bradford for Better, and I think just trying to sort of do things in the community that we are hopefully trying to improve on all aspects, and including health and environment, and you know, the social side of it. I go back to when my dad used to take me to the allotment. He's now probably in his late 70s, and he's still got the allotment. So we grew up sort of growing strawberries and having a community garden just down the road at Bowling Park. So, you know, it's quite personal, and hopefully we can sort of apply the similar sort of connections with what we've got with through Bradford for Better, with our WhatsApp groups and our local grassroots on the ground sort of links, and make it really successful, and somewhat that the young people and their families can enjoy. Thank you, Shadim.
Sorry, I was speaking to myself. I was on mute. Kulsum, I don't know if you just remind me, was there any questions that we've missed in the chat? I think Karen Dobar may have had a question. I don't know if Karen's still with us.
Yeah, I've been looking. No, I don't think there's any questions that have come up yet, apart from people sharing information and contact details.
Yeah, no problem. Well, if there is anyone who wishes to ask a question just before we come to the end of the session, then feel free to unmute yourself or put it in the chat box. But just wanted to say a thank you to all the speakers, particularly to our research fellows, across the different universities that have joined us today, because I think at the start of the pandemic, there was a very sort of quick response, and I wouldn't call it a knee-jerk reaction. I think it was just the circumstances, and myself and Sonjia and Kim and various other people met literally days into the pandemic. And I think as organizations, as institutions, we just responded and did as best we could. And I think Bradford did well in many ways. But I think the benefit now of hindsight and the benefit of the research and the knowledge that's been gained through this process is what needs to be applied to start looking at the recovery aspect of this. And I have been speaking to Kim Shuttler and a few other people, Sue as well, about the next forum. So just for those of you who have joined the forum for the first time, we actually established this at the start of the pandemic. Myself and Will Sutcliffe and Matt Henderson and a few other people who were primarily involved in supporting asylum seekers and refugees thought the forum would be useful just to share what's going on. And it's obviously come a long way since the start of the forum, and we decided to restart this forum again at the start of Jan, when the third lockdown kicked in. And you can see how the narrative has changed, because the first few sessions were all about food, and it was all about comms and messages and the sort of very basic level stuff. But as we've kind of advanced and progressed, the common theme and the knowledge that's being shared is different, and it seems like we're starting to move towards a more sort of positive way forward. And I know Kim's joined us as well. Kim, are you okay just to say, we'd had a conversation about the next session, and what we're looking to do on the next session is to have a discussion about how the health services in the city, be it the NHS and people like Karen Dober and people who work within BRI, and we've got other mental health services, how well they connect with communities, because some of the stuff that we've talked about is technology, but what we've also seen is how sometimes technology can be a barrier to certain communities. So can I just introduce you there, Kim?
Yes, please. Hi. Nothing like being put on the spot, is it?
So Kim, just an introduction for the next session.
Yeah.
So what we're looking at doing, and we're interested to hear from other speakers as well. So if there's anybody else who wishes to speak at the next session, what we'll be looking at is how well the statutory services around health, how well they engage with individual communities. And we've seen that there is clearly some gaps. So just from a mental health perspective, Kim, what are your thoughts on that in terms of that next session?
Well, I suppose some general thoughts on it is, I think that, sorry, I'm Kim Shuttler, I'm the Chief Executive of the Cellar Trust, but I also am the Chair of the VCS Assembly. So as far as you possibly can when you're trying to represent the voices of about 5,000 plus organisations in the district, I attend various boards to try and shout very loud about the power of the VCS and the work that you're all doing. I think in terms of the reach into communities and the amazing work that some of us of which has been sort of showcased today, I think there were lots of advocates for our sector already amongst statutory partners and funders, but the ones who perhaps weren't convinced before, I think, are now. So they've seen that it's the small, the grassroots, the local organisations that have mobilised. It's, you know, it's not, some of you might be from bigger organisations, but it's been the local ones who've put everything aside and said, actually, we're not in here for the contracts. We're not here to say, oh, that's not one of my outcomes. We're here for the people of the district, and we'll do whatever it takes for the people of the district. And I think that's been amazing, continues to be amazing, and people on this call and beyond have worked relentlessly. I think there's some real clear understanding now that and I think, I don't know if Karen's still on the call, that actually the sector is it can't be used as a proxy for communities, but it is very, very good at reaching communities and has trust with people that they work with in the ways that statutory services don't always have. So I think we heard in one of the reports that we're saying, yeah, trusted voices, but that's not always health services, is it? It's sometimes people really actively don't trust statutory services, and particularly, you know, given the hostile environment for lots of our communities. So so I think I'm really, really pleased to see that more money has come out through some of that stuff that that Ren talked about and Sue Crow. But I think the opportunity here is now we've been able to demonstrate that we can engage with people in a different way to statutory services, to just continue to build and grow on that. The other thing that I was just going to say to sort of research colleagues on the call is, you know, sometimes I sit on these calls and there's presentations from John Wright and born in Bradford, and I think, oh wow, that research is fantastic, you know, they're really listening to it in terms of the community insight. But then I also think, controversially, oh my word, we have this sort of insight every single day that we could share, and what we're not so good at as a sector is collating that all and aggregating that up so that we can be really powerful in saying, look at this insight that we're gathering. And that's so hard when everybody's delivering frontline stuff every day. But we've got to, I personally think that really to make the difference to services, we've got to be better at capturing that insight that you guys are gathering on the ground and finding the avenues in to feed that into policy making, strategy, service design in a really powerful way. So I don't know the answer to that. Some of you might have the answer to that. And if you do, please get in touch. I'd love to hear from you. So yeah, so sorry, Shadim. You know,
no, brilliant. You've stepped in because I was going to put Karen on the spot actually, but I know how well Kim's always prepared. So thanks for that, Kim. And a message from Karen is that I have lots of ideas on how we can improve as a hospital and take learning from you guys or this network or the wider community. So the next session is going to be on the 24th of February. And we'll have hopefully Kim Shuttler and Sue Crow and Karen and a few other people who are involved in health services to kind of open this discussion up about how we can look to improve that. We have come to the end of the session, so if anyone wishes to jump off, feel free to do so. I have just had a message from Shamila who wanted to share something. So Shamila, you please go ahead if you want to unmute yourself. This is Dr. Shmaila Anwar.
Thank you. Can everybody hear me?
Yeah.
Great. Yeah, it's just at the point that you were raising about kind of, you know, how well do we engage with communities? And I think that maybe asking me 3 months ago, the answer would have been very badly. But I think for the last few months, the kind of general coming together, particularly of the Asian community, I think in areas such as Bradford, has been phenomenal. and we're all kind of starting to get joined up. And I think that we're now, these organisations like the NHS, like the NHR, are really starting to understand what it means to engage with communities. Because at the end of the day, if we don't engage with communities and understand how they work, we don't know how to serve them. And our role, our duty is to understand how we serve these communities better. And I think that includes, obviously, everything to do with COVID and misinformation or disinformation, whatever you want to call it, and being able to understand and respond to those concerns appropriately, but also beyond COVID as well. And I'd like to think that this is like a dawn of a new era now, with all our communities actually taking more responsibility and control of being able to be informed about their choices. And, you know, I think certainly today it's been great to see all the initiatives that are happening across our, you know, our region, and it's really great to see.
Thanks for that, Shmaila. Kaneez, you're on mute, Kaneez.
I'd just like to say that from the insight that I'm getting across West Yorkshire, and if anybody's on Twitter with me, I don't like mince my words. I'll just say it how it is. There is still a massive challenge, whether anyone wants to be denial about that or not, about it's not vaccine hesitancy, it's honestly, it is a basic lack of trust in government and trusting that government and what's going to be in the vaccine and what are the long-term side effects. And these are genuine concerns that people from Black minority ethnic communities have. And it's really important that we listen to them, give them their space and give them the answers. But I think if we don't, and maybe it's something about this micro thing that we talked about, Shadim, about going right micro into the communities with our local butcher shops, with the barbers, with the shisha bars once they open, and these type of places to be having these conversations. And then even when, like, for example, if a community organization like last night, BHI, were hosted the event last night, the people on the ground, the community on the ground was saying, you're funded by government to do a pro-vaccine campaign. That's what you're doing. It's not, BHI wasn't there to do a pro-vaccine campaign. They were there to say, let's have a conversation about this. We want to hear what you've got to say. We've got professionals here with some of the answers, probably might not have all of the answers, but until we have these things, people are not on Twitter. So our Muslim women, a lot of them Pakistani, the Black women, the older women, they're not on Twitter. Our old men, they might be at the mosques, but they're not going to be on Twitter. That's why mosques and temples and gurdwaras and all these places and churches are brilliant places to have this vaccine messaging. Before we get to the recovery, we really need people to engage with the fact that we want this protection from the vaccine. I know most of my family won't be having it. The youngsters especially, the older ones, I'm taking my dad tomorrow, but he were in denial first until I said I'm having it. So these conversations need to be had, whether they're at a micro level or macro level, and it's not about social media actually, because it's not, it's about those real trusted relationships within our communities on the ground, people talking to each other there, so that they can give that factual information back. And I'm saying that because we won't get to the other end if we don't get this vaccine rolled out.
Yeah, thanks for that, Kaneez. I don't know if your hand's up from before, Shmaila, or if there was something that you wanted to mention.
Yeah, I think just sort of to answer your point there, I think you're absolutely right, Kaneez, and I think that has to start. We've got to understand that these communities, you know, we talk about the individual communities like the Black community, then, you know, the Asian community, but actually what we sometimes overlook are the similarities. Most of these communities were under the British Empire at some point. Most of these communities were invited in the 50s, 60s and 70s to come to the UK to bolster the economy, or, you know, with a promise of a really idyllic life. And that life was anything but idyllic. It was full of racism, discrimination at a systemic level. So and then, you know, 50, 60 years later, when things still continue and we don't have that acknowledgement, and then a pandemic hits, and then all of a sudden, you know, our community, these communities that have had this suffering for such a long time, are the kind of main focus of the pandemic, because that's where, you know, people are, you know, most affected. These communities are most disproportionately affected, and then the government is saying, oh, you know, we need to socially distance, we need you to have a vaccine. I think there needs to be an acknowledgement of the past failings of organisations, absolutely, because I think when you get off onto that equal footing, that puts you in a better place. And I think for me, it's always been about understanding the communities that we want to serve. And in order to do that, we've got to acknowledge our past failings, i.e. the government's past failings or the organisation's past failings.
Fantastic. Well, I thought it was a shame not to open this discussion up, really. I think Kathy's got something to add as well. Oh, you haven't? Oh, just a thumbs up. Okay, cool. Well, look, I think we'll call it there. It's been a great session. Thanks again to all of our speakers and everybody else who's contributed. We will be sharing the minutes, so soon we'll put the minutes together. If there is any other comments that need to go into the chat, then or contact details, feel free to drop them in. And we did initially just plan to do 3 sessions, but given some of the interest, we will carry on for the next maybe 4 to 6 weeks. I think as long as there's a value and people are engaged and people take some benefit from these sessions, then it's worth carrying them on. But well, thanks again, and enjoy the rest of your day and your week, and we'll catch up soon. Take care. Bye now. Bye, Sue.